Many parents are worried about a baby crying like this. So obviously, it's not an uncommon scenario. In the first few weeks, especially starting from 2 weeks onwards till around 8 to 12 weeks, many babies cry excessively. And we label it colic. Of course, there are stringent definitions based on the time duration, hours in a day, number of hours in a week, and so on. But in practical terms, almost all babies have a degree of colic. It's about whether it's significant or whether it's bothering to a high level. To make changes is what the question comes up. So in the first few days, it's very important to remember that the baby's ability to digest the milk is limited. They have a low level of lactase enzyme when they're born to digest the lactose in the milk sugar. And obviously, this upregulates in the first few days. So there is a reason why the breast milk comes slowly. The first few days, the milk quantity is slowly increasing, and then it starts reaching a level the baby can digest comfortably. In a baby who is not breastfeeding, or in a multigravida mother where the breast milk flow is fast from the beginning, the baby may have gas upset and that excessive crying in the first few days. So teach them how to face the feeding, not to overfeed in those situations. There are multiple reasons why colic happens. Obviously, it could be a developmental issue related to the maturation of the brain, the fine tuning of the gut-brain axis. So we have the communication between the gut and the brain hugely facilitated by the diet as well as the nature of the bacteria in our gut. This is called the gut microbiome. And that's the reason some physicians as well as some studies have shown that probiotic supplementation might change the pattern of colic, but I wouldn't call it an essential aspect. In a breastfeeding baby, for example, the mother's own gut bacteria or the skin bacteria colonize a baby, and that helps a lot. The breast milk itself has healthy bacteria as well as factors that help the healthy bacteria to flourish, like the bifidobacterium species in the gut. The human milk oligosaccharides are a whole group of non-digestible oligosaccharide components in the milk, which has the main purpose of getting the gut microbiome in the right format. Obviously, things like antibiotic use in either the mother or the baby, separation of the mother and the baby in the newborn period, like the baby in the intensive care, antibiotic treatments, use of probiotics, delivery mode. I mean, the cesarean section deliveries don't have the healthy gut microbiome phased in from the vaginal flora. While the baby is born vaginally, have this vaginal seeding, we call it the mother's vaginal flora, gets into the baby's gut, and the pattern of development mimics the mother's gut microbiome as well through that. So this has a long-term impact. The gut-brain axis has a impact on regulating your eating patterns, satiety habits, the response to stimuli, as well as the long-term changes like the risk of cardiovascular disease and so on. So that's a separate topic. But in terms of colic, the main thing is for the parents to realize that this is a developmental change. The baby is getting used to both the milk volume, the digestion of the milk, as well as the communication with the gut-brain axis and how the baby self-controls that or regulates that. So it's important not to panic. This is self-resolving, so it's almost like a normal phase of development. The baby does get anxious and cries a lot, and it does get distressing. So distraction measures like massage, movement of the leg facing up through the tummy, carrying the baby around, rocking, even a drive in the car seat, keeping the baby safe in a car seat. These are things that parents find helpful. There are some medications used over the counter like simethicone based preparations. Again, they work by distraction, the taste change in the mouth, or the baby forgets to cry for a second and then they're okay. Whether the actual change in the gas bubble to burp it well makes a difference, we don't know. The studies have not shown a huge impact, but most of us use it as a temporizing measure to help the parents tide over. If the crying is very excessive, obviously you need to think of other factors. The overfeeding is definitely a factor. Reflux can contribute. If the baby is overfeeding, they tend to bring the milk up, and that's not ideal for the baby because reflux causes pain and esophagitis. So focus on comfort measures, focus on breastfeeding, focus on self-regulation by the baby. At the same time, don't overfeed. So if you use the breast as a pacifier, the baby keeps feeding from the mother, and that can lead to overfeeding as well. So try to have a reasonable pattern. In the first week, when the milk is still coming in the breastfeeding mother, we say feed every 2 hours. That is to keep regular stimulation and ensure the milk is there. But usually by 4-5 days, you come to the pediatrician, you check the weight, and you realize the weight is gaining, the baby is passing enough urine, starting to sleep well. So this means the milk is coming. So So in this situation, you step back and allow the baby to wait more. So don't wake up the baby every 2 hours. If the baby is sleeping 4 or 5 hours, encourage that pattern because the baby self-regulates better. And the less frequent feeding pattern leads to less lactose exposure, and overfeeding risk is lower. So likely that you will have less colic as well. So the pattern of feeding, you can say 2 to 5 hours in a breastfeeding baby, and in a formula feeding baby as well, try to maintain that longer gap if possible. Don't follow the instructions on the tin if the baby is on formula feeds, because they advise you to overfeed. Your baby is unique, do go with the weight gain and regulate accordingly. So in simple terms, colic is self-resolving. Tide over with these measures I discussed. Use pharmacologic treatment which can work like placebo, or soothing effect or distraction. Massage, oil massage on the tummy, positioning, carrying around, these help as well. Be patient. Whether you use a pacifier is up to you. In the first few days when the latch is establishing, don't use a pacifier to avoid nipple confusion. But beyond that, if you are finding it difficult to space the feeds, I do feel in the first 3 months you can consider using it, but stop it by 3 months if you're using it as well, because continued use can lead to dental issues as well as habituation. So try to stop by 3 months if you do use a pacifier. Beyond that, it doesn't have any role. And baby can self-regulate, they can chew on their hands. That doesn't mean hunger, so don't over-interpret hunger as well. So I hope this helps. There is no clear-cut role of probiotics. They're expensive, they may not be covered in the insurance, and of course quality control becomes an issue. If you are going for cheaper brands, you may have safety issues because it's live bacteria we are dealing with. So be careful. It's not essential to use it. Focus on breastfeeding. Comfort formula in a formula fed baby is an option as well, because they have lower lactose load, but again the overall volume of feeding plays a bigger role than the actual lactose load from the milk itself. So if you give a lower lactose load in a larger quantity, that again will lead to same issues. So it's a dose of lactose in a day, not the actual amount in 100 ml of the bottle. It's what the baby takes that matters. If reflux is playing a role, look at reflex measures. It's not a bad thing to position the baby slightly upright, and to burp well after the feeds, and to delay and space the feeds as best as you can. So these are general measures that would help. Thank you.